Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Morning, Sharon. You're the first to comment. You win. Morning, Teresa. It's just talking about you. Were your ears ringing?
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Morning, everyone. It takes us a little longer to get things rolling in the morning now. Mom still needs a little bit of help, although she's doing better. Yesterday afternoon was rough, and I guess it's just going to be a bit of a roller coaster for the next few weeks, and then hopefully we are back to normal. Okay, so I don't have all the details of this particular event that I'm going to talk about, but it was something that I saw on Facebook. No, what did you do, Tris? You didn't do anything. We were talking about when you guys are going to move south. So I was emailing with Joyce. So, because Joyce is moving. Anyway, there was something that I saw in a Facebook group where somebody said that their dog had their puppy, a little 3-pound puppy, had a horrible reaction to a set of vaccines, and multiple vaccines were given at the same time because that's how most veterinarians do it. And on a 3-pound dog in particular, that is dangerous. Why would you be jabbing a 3-pound dog with multiple vaccines at the same time? But so the dog had a horrible allergic reaction. Projectile vomiting is how it was described. Well, that's just about an anaphylactic shock reaction. That's bad news. But the dog did get over that. So when it was time for the next set of vaccines, so the third set of puppy vaccines, and this is the third set given by the veterinarian for this dog. I don't know if it had more at the breeder or pet store or wherever it came from initially. Again, I don't know all the details of this particular scenario, but so when it was time for the next set of vaccines, the veterinarian said, okay, we'll give the dog some Benadryl before the next vaccine, and that should solve the problem. So the owner did, and what I didn't ask, it's a small dog, so clearly was giving liquid Benadryl, and I didn't double check with the person to make sure that it didn't have any xylitol in it, and hopefully the veterinarian warned them about that. So that's another little key in this whole thing. If you're going to use a liquid Benadryl or any human medications, make sure that they do not have xylitol in them, because that will kill your dog or cat. So she gave the Benadryl, got the vaccine, and said, well, this time they only gave one vaccine. Well, let's face it, most veterinarians don't have single distemper and single parvo. They're still giving a combination vaccination. So minimally, it probably would have been a DAP, which is distemper, hepatitis, parvo. And frankly, not many veterinarians have that. Most of them, their combo vaccines have 4 or 5 things in them. So they're calling that a single shot, but it is actually multiple in one syringe. And actually, I didn't vaccinate our horses this year because the only vaccines that the veterinarian carries are either a 4-way or a 5-way. I don't want 5 things injected into my horse, especially the miniatures, at one time. So the dog got the vaccine, and so this is how the post initially started. The person said, well, I we got only one shot and gave the Benadryl, and the dog is drooling. Well, I don't know what that ding is. The dog is drooling profusely. So, wanted to know if that was normal. Well, that's not normal. Drooling profusely is a sign of nausea. So this dog was having a reaction again. But the owner was all happy because she said, well, at least it's not projectile vomiting like last time. Okay, less of a reaction, but still a reaction. And my response to that was, I would never vaccinate that dog again. That dog is clearly having trouble with these vaccines. And Benadryl is the only thing between that dog and death from a vaccine reaction, because these guys can go into anaphylactic shock. They collapse, their blood pressure bottoms out, they die, they get swelling in their lungs, they have vomiting, they have diarrhea. It can be deadly, especially when you're dealing with these little teeny tiny dogs. You have to be so careful with them. Big dogs just tend to handle it better, but small dogs and some of the purebred Oriental cats tend to be more reactive as well. So like the Asa cats and I can't even think of all the Siamese, Burmese. Those cats tend to be a little bit more reactive with the vaccinations. So it is so important that you ask for minimal vaccines. Make more trips back if you have to, but get them one at a time. Beg your veterinarian to carry single distemper, single parvo. Most of them won't do it. There is not a single distemper vaccine on the market right now. We were actually using the one labeled for ferrets. It is a canine distemper, but it's the only single distemper available right now. And if you have a small breed dog in particular, spread them out, give minimal vaccines at the same time. And if they have an allergic reaction, you need to be so careful. And giving them a steroid at the time of the vaccination may actually suppress their immune system so much that they don't have a response to the vaccine and they're still not vaccinated. So, titers wherever you can. But this little dog that had this horrible reaction, even if the titer came back low, I would be hard pressed to vaccinate that dog. And it depends a lot, and I don't know all the particulars. It depends a lot on the lifestyle. Does this dog need to go into high population, crowded situations? Does it need to go to the boarding kennel? Does it need to go to a very busy, overpopulated groomer? Does it need to go to daycare? Since it's a 4-pound dog, I'm betting it probably doesn't have to do a lot of those things. Those guys are usually kept, fairly well secluded. But you need to, and what do I think about the thimerosal free? I think that is the way to go. I got to sign off real quick. I got a phone call that I think is a doctor for mom. Talk to you guys later.